By Lindsay Whitehurst and Leah Willingham, Associated Press. In Tennessee and North Carolina, demand for the COVID-19 vaccine has slowed down so much that they have given millions of doses back to the federal government, even though less than half of their total populations are vaccinated. Oklahoma has not asked for new doses from the government for more than a month, spurning its 200,000-a-week allotment. Around the country, states are rushing to use up doses before they expire this summer. The U.S. is confronted with an ever-growing surplus of coronavirus vaccine, looming expiration dates and stubbornly lagging demand at a time when the developing world is clamoring for doses to stem a rise in infections. Million-dollar prizes, free beer and marijuana, raffled off hunting rifles and countless other giveaways around the country have failed to significantly move the needle on vaccine hesitancy, raising the specter of new outbreaks. The stockpiles are becoming more daunting each week. Oklahoma has more than 700,000 doses on shelves but is administering only 500 a day and has 27,000 Pfizer and Moderna doses that are set to expire at the end of the month. Millions of Johnson & Johnson doses nationwide were set to expire this month before the government extended their dates by 6 weeks, but some leaders acknowledge it will be difficult to use them up even by then. We really cannot let doses expire. That would be real outrage, given the need to get vaccines to some under-vaccinated communities in the U.S. and the glaring gap in vaccinations and the inequity of vaccinations that we have globally, said Dr. Kirsten Bibbins Domingo, chair of epidemiology and biostatistics at the University of California, San Francisco. The U.S. averaged about 870,000 new injections per day at the end of last week, down sharply from a high of about 3 million a day on average in mid-April, according to the Centers for Disease Control and Prevention. President Joe Biden wants to have 70% of the adult U.S. population at least partially vaccinated by July 4. But the U.S. could well fail to meet that target. As of Friday, 64% of Americans 18 and older had had at least one dose, by the CDC's count. Some states, especially in the Northeast, have already reached that 70% goal for adults, while places like Mississippi and Alabama are nowhere close. Amid the glut, the White House has announced plans to share 80 million doses globally by the end of June and also buy 500 million more doses of the Pfizer vaccine and donate them to 92 lower-income countries and the African Union over the next year. With demand stronger in Maine and Rhode Island, the two states both got 400 doses from Mississippi, where just 35% of people have had a first dose. Mississippi has returned an additional 800,000 doses to the federal government. The state has seen demand plunge to December levels, with only 14,000 doses administered there this week.